Hey guys, it's Dr. Braddock and Dr. Clay with Legacy Gold, where our focus is to teach you how to communicate what it is that you do to the people that need your help at the very highest level. And so today, on today's video, we want to cover some comments that came up on a video that were basically commented on yesterday. That video was the bone in, bone out of place video. A couple of people commented.
Sorry if I butcher your name. Dr. Jim Wagner, Brian Nymphius, who else do we have here? Evan Katz, Brett Wickstrom, and sorry if I'm forgetting a few other of you guys, but obviously this was a video that I know for me personally, I was a little concerned that maybe the video wasn't even a watch completely.
Yeah, so the thing was bone in, bone out, and we had one of you guys that had said the question, hey, I have a patient that keeps saying, the bones popped back out, and how long will it stay in? And so we were basically taking a question submission, and then talking to that person about how to work the way around it. Again, if you haven't watched that video in its entirety, don't watch this one. Just hit stop on this, go watch that video in its entirety. Then come back and rejoin us.
And I think one thing that is different about that video is if you don't watch the whole video, then it doesn't really make, you're not going to get everything from it that you need to get in order to know exactly what it was we were trying to help you with in terms of communication with patients whenever they say, hey doc, I think this is still out. You know, think about it this way. Not every patient walks in your door and says, hey, I think this is out. Most of your patients probably have never even been to a chiropractor before, or I know I've seen that over the last 10 years. I'd say a majority of my patients have never been to a chiropractor or had a chiropractor explain bone out to them that way. And so we made that video primarily for doctors who are coming to us saying that they're having a hard time with patients who keep saying, why won't this thing stay in? Why does it keep coming out? And so we created that video in order to handle that particular objection from patients. And that video has nothing to do with technique, how you're going to adjust, whether you use an activator or you pray over them or you adjust them or you hit them with a chicken. None of that had anything to do with that video. Everything had to do with communication.
Absolutely. So at the end of the day, the goal isn't that we teach you guys how to, we're not making some outlandish claim that we have chiropractic by the tail and we know more about chiropractic than anybody else. We got to thinking a little while ago at lunch talking about this very subject. If you want to know more about the subluxation complex and motion deficiencies and what actually happens during the subluxation, we think James Chestnut's probably got a best handle on that of anybody in chiropractic. Go look up James Chestnut, go to his seminars, read his books, learn subluxation. We're not telling you what subluxation is, we're telling you how to communicate. And so subscribe to James Chestnut. If you want to know adjusting, the best adjuster that I've ever been around or been adjusted by, and I think Brian would agree with this, is Arno Brunier. And so if you want to learn how to adjust, you go to an Arno Brunier seminar. He's going to help you do that. If you want to know, somebody mentioned about measurements in the sagittal plane and pre and post x-rays, then you're looking more like CBP. This is highly researched stuff. You talk to Dean Harrison, he's your guy. There's 3 chiropractors that we would consider almost idolistic, superstars in their field, that could not be more different from the 3 of those guys.
And the three of those chiropractors, if you put them in the same room, I don't know this, but there's a good chance that they wouldn't even get along, because that is the nature of chiropractors. Unfortunately, in our profession, chiropractors have a huge propensity to literally circle the wagons and fire at each other.
Yeah.
And it makes no sense. And so really what we're trying to do, guys, we're trying to help you with communication. Even if you do a technique that neither one of us do, but you're trying to use that technique to accomplish a particular objective, we'll help you do that. So we're not here to talk so much about the science of chiropractic as we are to try to help you take what it is that you're trying to accomplish to help a particular patient, to help you actually achieve that through verbal communication.
There's so many. We had a new patient in my office yesterday that had been to numerous chiropractors, and some of them that I actually knew. And he said, I always thought physical therapists really had a much better grasp on things than you guys. I always thought they were going to give me the long-term solution, and chiropractic was really a short-term fix, like you would get a massage. but he said, no one's ever explained this to me. Like, this makes so much sense. The guy went on and on and on and on. And there's so many chiropractors out there that that maybe are great adjusters. Maybe they have a huge handle on the science, you know, the subluxation complex, whatever sort of thing they're doing, but they don't know how to communicate it. They don't know how to let people know what makes you uniquely different and highly skilled at being able to get that person the very best results. Why should they trust you with their time? Why should they trust you with their money? Why should they trust you with their children? And if you can't communicate that, it doesn't matter what you know.
No, it's
it doesn't matter
yeah.
how good you can adjust. And you probably, some of you probably watch this video and you think that we're making these videos to try to turn the way that you practice. We're not. Keep doing what you're doing. You know, we're not going to try to change the way you practice. We have friends that are multidisciplinary. We have friends that are medically integrated. We have friends that are as straight as a stick, that are box on the wall, Atlas only. We have a lot of these friends, and probably I think Brian's strong suit, one thing I try to emulate from him is he's able to communicate with almost anyone and get the pieces of that he can use in his practice. And so if a person is an activator doctor, medically integrated, whatever, something that may be quite different from what he does, he's still able at the end of the day to try to figure out what things that person knows that he might be able to utilize. He doesn't take offense that that person's trying to change the way he practices. He just wants to know what they know and be able to integrate that. And so at the end of the day, that's the thing you have to understand. This video, any other video you see put out from us, we don't care if it offends you, but two, we want to try to give you some stuff that you can steal pieces of it. One of us may say something that you're like, I hate that. I would never say that. I don't like that. Those guys don't know what they're saying. Fine, don't use that part. You're not paying for this. We're not charging you anything. So just don't use that part, but don't sacrifice the rest of it that you might be able to steal a line, steal a word, steal a tactic, or, you know, a strategy to use in your practice. Use the video, you know?
Yeah, absolutely use the video. What he says couldn't be more true. My favorite chiropractor that adjusts me, I mean, Caleb and I adjust each other all the time, but my favorite chiropractor that takes care of me has a practice that I fear that the doors will not stay open. He's the best adjuster that's ever adjusted me, but his communication skills are the worst. And, you know, it's not that I don't try to help him, it's just, you know, that's not where he's putting his effort in. And so just make sure that when you watch these videos, you watch them from the mindset of this is about communication. This isn't about whether you do CBP or whether you do Pettibon or whether you do Activator or whether you do Diversified or whether you do Thompson. I mean, we both graduated from Parker, 9 different techniques. You know, I don't really agree with that. And further, I do things in my office that Dr. Braddock would never do in his office. And there's things that he does in his office that I would never do in my office. But we're still best friends, we're still coaches, we still see chiropractic the same way. And especially in terms of communication, that's where we've tried to, we push each other to you know, over the last, you know, 10 plus years to be great communicators, because that's what we have found. The chiropractors that have the highest level of communication, those are the biggest booming practices. They're the ones that help the most people. And I learned that early on in school, that it seemed like the chiropractors that got hated on the most, they had one thing in common: they saw the most people. Right? So it's not always the truth. You know, obviously you've got some chiropractors that get in trouble for being too hands-on and they wind up in the news. Sure, they get talked about a lot. But I tell you what, you know, the guys out there, the gals out there that are just phenomenal communicators, they can be horrible adjusters, and they have amazing practices. So let's stay away from technique. Let's stay focused on communication. And we appreciate all your comments. We appreciate all your feedback. You're never going to offend us. You know, chime in. The reason we made this video was to respond back and to make it clear what it is that we're trying to help you guys achieve. And stay tuned. We've got a few more videos coming out that are going to address some more topics that you guys have brought up, which we really appreciate. The more topics that you guys bring up for us makes it so much easier for us to shoot these videos, because sometimes we find ourselves looking at each other like, man, what would be the best thing next to talk about? But when you guys share and you like and you comment, and that makes our job easy, and we know exactly what it is that we need to be talking about. So
no doubt about it.
Once
Keep the comments coming.
once again, thanks so much for watching this video, and stay tuned, and look forward to talking to you guys soon. God bless.
God bless.